Welcome to North Olympic Library System's Aging Well program for November 2024. Bree Buchanan, Dementia Outreach Development Coordinator for Olympic Area Agency on Aging, is here to provide an overview of the resources available to support dementia patients and their caregivers. So thank you for joining us, Bree, and welcome to welcome to Aging Well.
Hey, thank you so much for having me. I'm going to share my screen. Okay. Can everybody see that okay? Great. So I'm Bree Buchanan, and I work with the Olympic Area Agency on Aging. I am the Dementia Outreach Development Coordinator. I realize that is quite the mouthful. I work heading up our Dementia Outreach Program, which is a new program this year. And so a little bit about myself. My contact information is on the screen, so feel free to write that down or take a picture. I will share that at the end as well with you all again. So I've been working with adults living with dementia for the past 16 years. I started working within the senior care industry in 2008. I have worked in adult day healthcare settings, skilled nursing facilities, memory care communities. I worked as the West Living Corporate Director of Memory Care and Brain Fitness Programs, and also as their Director of Resident Engagement. And in 2018, I began working with the Alzheimer's Care Associates as a nationwide consultant for memory care environments, specializing in creating signature programs for those living within a memory care environment, training their staff on the new programs, and helping implement the new programs. I hold a bachelor's degree in sociology from the University of California, Santa Barbara. Go Gauchos. And I've been with Olympic Area Agency on Aging, also known as O3A, so you'll hear me use O3A a lot, since January of 2024. And I came on board with O3A specifically to help create and establish this specific dementia-based program. I'm originally from Carpinteria, California, and raised on California's Central Coast. My husband, though, is from this area, and so we moved back here to the Olympic Peninsula in 2020. And we have 4 wonderful children and 2 dogs, and we live in Sequim. So for today's agenda, we're going to cover the Alzheimer's facts and figures for 2024 that's provided through the Alzheimer's Association. We're going to look at the 14 lifestyle modifiable risk factors for Alzheimer's and other dementias. We're going to look at understanding the needs of our communities and the Building Dementia Capable Communities grant. And then we're really going to dive into our evidence-based programs that we offer here locally now, ways for you to get involved, and then we'll end with a time for Q&A. I'd also like to add that although I am a dementia care expert, I am not a physician. So if you have any specific medical related questions regarding dementia, I recommend that you make an appointment with your physician and make an appointment for that topic to discuss either memory loss or getting a memory screening or specific symptoms that you may be experiencing with yourself or for a loved one. Don't try to squeeze that into another appointment that's meant for something else. I recommend you make an appointment specific to that need. So before we get started, I wanted to share this infographic to help understand the connection between the word dementia and Alzheimer's. There's a lot of questions between how those two are related and how they interact with each other. The word dementia is not a specific diagnosis. It's not a specific disease, but it's a word similar to pain or falling. It's a broad word used to describe symptoms. So as a person will have dementia symptoms due to a disease causing changes in the brain. You can have dementia due to Alzheimer's disease, or dementia due to vascular disease, or dementia due to Lewy body disease. So just like you can have pain, there is a specific cause of your pain. It could be pain from a broken bone, or pain from an infection, or pain from a bruise that you have. There is something more specific causing the pain. Same thing with falls. So when someone's having frequent falls, we know that something is causing the falls. It could be vision loss, or it could be shoes not fitting right, or weak lower leg muscles. Those can all cause the falls. So just like dementia is this broad word describing the symptoms, there is something causing those symptoms. And those are the different diseases that you see listed below. So looking at the 2024 Alzheimer's facts and figures, each year the Alzheimer's Association puts out updated facts and figures on Alzheimer's and other related dementias. And this is really well done. So for 2024, we're looking at nearly 7 million Americans are living with Alzheimer's. And about 1 in 9 people, it comes out to 10.9% of those age 65 and older have dementia. The percentage of people with dementia increases with age. So 13.2% of people 75 to 84 and 33.4% of people age 85 and older have dementia. 1 in 3 seniors dies with Alzheimer's or another dementia in their medical chart. That does not mean that 1 in 3 seniors dies from Alzheimer's. It just means that they have it present at the time of their death. Alzheimer's disease kills more people than breast cancer or prostate cancer, and that number is combined. In 2024, Alzheimer's disease and other dementias will cost the nation approximately $360 billion. Most of that money is coming from unpaid family caregivers who've had to leave the job or cut their job hours down in order to be home to care for a loved one who is living with dementia. But by 2050, these costs could rise to nearly $1 trillion as we see more and more people living longer and coming of age. Over 11 million Americans provide unpaid care for people living with dementia. And 70% of dementia caregivers feel stressed when coordinating care. And more than half of caregivers said navigating healthcare is difficult while caregiving. You can look at the rest of the 2024 Alzheimer's facts and figures at alz.org/facts. They're wonderful. There's a full written report that's pretty dense, but they have a video with all of these facts and figures that's much more digestible. So next, let's look at the Lancet. So the Lancet Commission on Dementia is a group of leading experts convened by the medical journal The Lancet, and their job is to review the best available evidence on dementia prevention, intervention, and care, all with the goal of identifying modifiable risk factors and providing recommendations to best manage or even prevent the development of dementia. In 2024, The Lancet released an updated version of the modifiable risk factors, and they actually added 2 more, those 2 being high cholesterol and vision loss. So you can see, I know that this image on your screen might be a little difficult to read. So I have the link up above, and on the next slide, I'll have the link larger printed for you to write down. But on the image, it starts with, they're separated in 3 different categories. They're separated by early life, midlife, and late life. So these are things that are causing a higher risk of developing dementia that can be modified, that you can control and change in your life. In early life, it is education. So we want to avoid lower or less education early in life. In midlife, we see, which the bulk of these are listed, things like hearing loss, cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, and excessive alcohol use. Now, this is not a one-to-one correlation. So if you have diabetes, that does not mean that you will get dementia. What it means is that if you have diabetes and you are not managing it properly, and you are having lots of highs and lots of lows in your sugar levels, and you're not staying within a healthy range, you are increasing your chances of developing dementia or depression for that matter. If you are not being treated for your depression, going to therapy, taking medication, you are increasing your chances. So we want to do things. We want to address our hearing loss and wear hearing aids. We want to have a better diet and exercise more to manage things like our cholesterol, our hypertension, our obesity. We want to stop smoking. We all know that one. And if you've had a traumatic brain injury, you want to make sure you're staying up on treatment for that, receiving therapy, physical therapy, occupational therapy, taking your medications if you have any, staying on top of the aftercare of that traumatic brain injury. Now, in late life, we have things like social isolation, air pollution, and vision loss. So COVID did a number on our elders with social isolation. And we have a lot of people who are still remaining in social isolation. It's really important later in life that you have a social support network, that you are out doing things that you enjoy, even if it's meeting friends for a cup of coffee, going on a walk with your family, things that are getting you out of your house in public with people who you love and enjoy, and doing an activity that you love and enjoy is very important later in life. Air pollution. Luckily, we live in a beautiful place and we have very good quality air here. But if you're living in the city, this can have an effect on your mental clarity. And vision loss. Making sure you have proper prescriptions, proper eyewear, that your glasses are cleaned and things like that really helps. So here is the link to the Lancet, that infographic. It's listed here. You can take a picture. I'll leave it up for a second for you guys if you want to write it down. That way you can go to that infographic and look at it on a larger screen or even print it out and review that. Also, I didn't mention it at the beginning, but if you do have any questions about anything on here, please feel free to write it in the chat, and we will have time for Q&A at the end of this presentation. Okay. So now let's look at a more local need in our local communities. So the Olympic Area Agency on Aging serves 4 counties. We serve Jefferson, Clallam, Grays Harbor, and Pacific counties. We have 6 offices across the 4 counties for local in-person support. Those offices are in Port Townsend, Sequim, Forks, Aberdeen, Raymond, and Long Beach in our southern counties. You can go in between 8:30 and 4:30, generally Monday through Friday, and receive in-person support, get resources in any of the offices. Or you can go online. Our website is also listed there, www.o3a.org. So in addition to our dementia outreach program and the resources we provide, we also do a lot more. Some of these are our free senior legal advice clinics. We provide Medicaid case management. We provide SHIBA support, which is the state health insurance program. So if you need help understanding your Medicare or signing up for Medicare, you can go to any of our SHIBA clinics. They are on a first come, first served basis, and we hold them throughout all of the counties. Right now is really busy because it is open enrollment. So if you need help with that, you can reach out to any of our offices. We also run the state ombudsman's program, which is an advocate for those living in long-term care settings. So we help and support residents with residents' rights, their families. If there's an issue or a disagreement with the facility, we help advocate and moderate those situations. We also have a family caregiver program. And this is not just for dementia family caregivers, but any family caregiver. Our Kinship Navigator program helps serve seniors who are raising other people's children. So it could be your grandchildren or great-grandchildren or nieces or nephews or foster children. Our Care Transitions program is wonderful and new in Clallam County. This program provides support to people who are being discharged from the hospital setting back to their home, and you can have a care transitions person help you with that transition, get information for you and resources during that time from a hospital stay to back home. And as always, our main program, our senior information and assistance. So anybody can either come in and chat with one of our INA staff, or you can call and talk on the phone if you need help applying for Medicaid or information on housing. Any of our programs, you can talk with our senior information and assistance team. So here are some numbers here about Clallam County. So you see here our three main towns in Clallam County: Port Angeles, Squim, Forks. Now these populations you see are within city limits. We're not counting all of those who live within the county areas, which is a lot of people, right? So in the next column, the population of 60 and older, you see within the city limits is about 29% for Port Angeles, 45% for Squim, and 16% for Forks. If we added up that, almost 6,000, 3,500, and 540, and we took 10.9% of it. Now I'm using 10.9, remember that is the number of seniors 65 and older who have Alzheimer's or related dementia. So if I use that statistic and apply it to our local numbers, we're looking at about 1,000 people in Clallam County's major towns having dementia. That's a large number of people. And we know over the past 11 months of running this program, we know that this number is accurate in the amount of people who are needing help and looking for resources in our communities. So we have a wonderful, wonderful organization in Washington called the Dementia Action Collaborative, DAC for short. And this is a group of public and private partners committed to preparing Washington for the growth of the population of those living with dementia. They're focused on creating resources and raising awareness to support individuals with dementia and their families in managing daily challenges in Washington state. So the DAC is overseen by the Department of Social and Health Services and Aging and Long-Term Support Administration. So we work very closely with both of those departments. And we received the state-approved grant to serve rural communities and stimulate the development of dementia-related services and supports. That grant is called Building Dementia-Capable Communities, or BDCC for short. At the state, we love our acronyms. So with this grant, we're working as a catalyst to create positive change and awareness within our rural communities and to help educate the public, caregivers, and really work with our local healthcare networks to increase medical service delivery in a more dementia-friendly manner. So the BDCC grant was awarded to O3A in December of 2023, and the Dementia Outreach Program began promptly on January 8th, 2024. This is a picture from our most recent Dementia Friends session at the Port Angeles Senior Center. And we'll talk more about what Dementia Friends is in just a second here. So what have we been doing with this large grant and these public monies to support people with dementia? I'm very happy to share a lot of this information with you. So the first one, Dementia Friends, you saw a picture from that. So we have, who is it for? This is for the public. It's for anybody in the community who wants to learn more about dementia. These are free 1-hour information sessions. This began on May 3rd was our very first session. And since May 3rd, we've impacted 85 individuals. So we've added 85 new dementia friends to Washington State. Then we have our Dealing with Dementia workshop series. This is for family caregivers, and we had our first workshop on May 30th, 2024. Since then, the impact has been 116 individual family caregivers. Our SHARE program, this is designed for the person living with dementia, that's what the PLWD stands for, and their care partner as a dyad. We started offering this program July of 2024, and we've already completed 4 cases. STAR C is designed for in-home family caregivers. We were trained on that in May of 2024, and we have completed 2 of our pilot cases. And our new baby is our Early Memory Loss Support Empowerment Group. And this is designed for the person living with dementia in the early stages or MCI, having some mild cognitive impairment. This will begin in December of 2024 in Jefferson County. So far, we have not had impact yet, but we are looking forward to that as well. So let's dive in to a little bit more. These are called our evidence-based programs, or our EB programs. So Dementia Friends in Washington State, Dealing with Dementia, which was designed by the Rosalind Carter Institute, Share for Dementia, which was designed by the Benjamin Rose Institute, STAR C, which was designed at the University of Washington, and our Early Memory Loss Support and Empowerment Group, which we have collaborated with the Alzheimer's Association on. Let's talk about Dementia Friends in Washington State first. So this program began at the University of Washington in the fall of 2022 at their Memory and Brain Wellness Center. At present, you'll see on there, it says 3,121 Dementia Friends in Washington State. Just this morning, we were updated that the last month we've added to that number. So actually the current number is 3,483 Dementia Friends in Washington State. So this is a free 1-hour info session on what is dementia, learning how to communicate with dementia, understanding the 10 top signs and symptoms of dementia. It's a very digestible 1 hour. It's not a professional training. It's not, you don't get CEUs or anything like that. It's designed for anybody to attend. Family members, people in the community, even children at school can easily sit through this 1 hour interactive information session. On top of the Dementia Friends Washington, We are also certified to deliver the Dementia Friends for American Indian and Alaska Native communities. This is the culturally tailored version, which for us locally, there are 9 individual tribes in our 4-county region. So it's really important that we also offer this as well, because community and family systems are much different within a tribal nation than they are elsewhere. And so we needed the language to be more inclusive and appropriate for our American Indian and Alaska Native communities. So I am the regional lead coordinator for Dementia Friends Washington for our 4-county area. So if you have any questions on Dementia Friends or want to get involved, I will be your contact person and who you can talk with. So here we have a map of Washington State. Everywhere that is dark green with the little blue and yellow person is where we have Dementia Friends operating. So in the majority of the state, which we are very excited about. And you can see on the most western side that those are our 4-county service area. It's a very large area of the state, and we are very happy to be of service to those 4 counties. So the way this works is a dementia champion, like myself, will host a free information session. And everybody who attends the session becomes a dementia friend. And you are added to that growing number that we saw on the other slide of the number of dementia friends in Washington State. And the goal of Dementia Friends is to increase awareness, increase empathy, and decrease stigma around dementia. We want people to understand our 5 key messages, that people with dementia still have value and can still contribute to their community, that people with dementia can still live a very fulfilling and healthy life, and some of our other messages as well. So the more people we educate on this, the bigger our community impact is. So if you haven't attended a Dementia Friends session, keep an eye out, and you can always go to our website's community calendar for our next Dementia Friends session. You can also organize one yourself, and I can come literally anywhere and host a session. Can even come to your home and host a session with your family and friends if that was something you wanted to do. Next, we have our Dealing with Dementia workshop. This was designed by the Rosalind Carter Institute for Caregivers. So this is a 4-hour workshop. It is only for family caregivers that are loving and caring for someone who is living with dementia. This is not for professionals. This is not for people who just want to come and learn more. It's also not for individuals living with dementia themselves. This is for the family caregivers. Now, you don't have to be living with the person with dementia or even in the same state as them. This is for a family caregiver. You can caregive from afar. You can be states away and be a caregiver and support your loved one. So it can be for anybody that meets that criteria. This workshop is free right now, thanks to our Building Dementia Capable Communities grant. And we are happy to be able to bring this wonderful resource and keep it at no cost for family caregivers. So these are our flyers. You may have seen these around. We did host one session, I believe in August, at the library in Port Angeles. Thank you very much. And we just held 2 of them last week, one in Port Townsend and one at our SQUIM office. So if you see these flyers around, this is for our Dealing with Dementia workshop. You do need to pre-register to attend the workshop. We keep these small group, no more than 20 people. We really want to help form a community and a social network with the attendees who go through this. So we like to have a small cohort of individuals. So that they can form a support group if they want, or share emails or phone numbers and meet after if they want. So you do need to reserve your spot. My name and phone number is on the bottom of our flyers. And again, we always have these posted on our community calendar at our website as well. So what are the things that we talk about? We talk about understanding dementia. What is it? Why is it present in certain people? Those modifiable risk factors. We talk about tips on caregiving, managing challenging behaviors, and the importance of building a social support network. You'll hear me use that phrase a lot. There's a reason for it. It is really imperative that people who are either living with dementia or caring for somebody with dementia have a strong social support network. And even beyond that, all of us should have a strong social support network. So if you are not as social as others, that's okay. But start thinking about, who could I get in my corner? Who could I bring into my inner circle to help and notice if anything's going off with me, or I'm not behaving at my normal baseline behavior? It's really important that you build a social support network for those reasons. We also cover a variety of proven strategies to manage stress, address obstacles to regular self-care as the caregiver, and we cover remedies for safety concerns. With this 4-hour workshop, attendees receive a large, beautifully made guidebook. And we really spend a lot of time in this workshop understanding how to use the guidebook, how to navigate the guidebook, where to go for different topics and resources within that guidebook. You only are able to take that guidebook home with you if you stay for the entire 4-hour workshop. This is an evidence-based program. So there is a pre-test that you take at the beginning of the workshop, and then a post-test that you take after. And what the Rosalind Carter Institute has found with this evidence-based program is people's confidence in their knowledge of being a dementia caregiver not only increases by the end of the workshop, but it increases even more a month, 3 months, and 6 months later. It continues to grow and grow and grow in a positive direction. So there is an opportunity, if you attend the Dealing with Dementia workshop, there is an opportunity to submit your email so that they can contact you a month later, 3 months, and 6 months later to see how you're doing. But their numbers trend upwards, which is fantastic. So next we have our Share for Dementia. This is another evidence-based program. This wonderful program was designed by the Benjamin Rose Institute in Ohio. And this might just be one of my favorite programs that we offer. So we are the only place in the state of Washington that offers Share for Dementia. I'm very, very proud to be able to say that. This is an incredibly wonderful resource to take advantage of in our area, and because you can't get it anywhere else. So SHARE stands for Support, Health, Activities, Resources, and Education. This is a program that uses an app on an iPad. You don't have to have an iPad. I already have that for you. And I come in the home with that iPad, and we go through these together. You'll see on the picture there's a couple looking at 3 circles on their screen. This is kind of the bread and butter of this evidence-based program. So those 3 circles represent the caregiver in red, family and friends in blue, and service providers in green. And we ask each individual in the program separately, who would you like to have help you in the future with certain things? So we would talk to the person living with dementia first, and we would say, who would you like to have help you with toileting if you need help with that? And they're either going to say, my spouse or a family or a friend or a professional. Usually what we see is that the person living with dementia has them a little bit more spread out, right? And then we see the caregiver, we ask the caregiver the same questions separately. The caregiver usually jams everything into their own circle. So when we present this information to the dyad, the person living with dementia and their care partner, it's an aha moment of, wow, I might want to do all of these things, but that's a lot. And when you put it down in a visual format, we can really get a better understanding of how overwhelming that could be. So the SHARE program is designed for people living with dementia that are in the earliest stages, who are able to have conversation, openly discuss their brain change, feel comfortable talking about the future and what their care might look like. And then they need to have a care partner with them. It doesn't have to be a spouse. It can be an adult child or a friend or a neighbor, just somebody who will consistently be with them. So how does this work? We meet in person for 6 weeks. And each time we meet for about an hour. And traditionally, we do meet in the home of the person living with dementia. This is for comfort reasons so that they don't have to travel and they're in their comfortable, safe space. Now, if that's not an option, we can always meet in my office. That is completely fine as well. We also have an optional family share session. And this is where we invite friends and family to come to a meeting all together, even if they live on the other side of the country. We'll use our owl and we'll get them into the room via Zoom or Teams. And we review the share plan that we've created over the previous 5 weeks and put it all on a nice organized paper list and get everybody on the same page. So we work on developing that social support network. We work on developing who the person living with dementia is comfortable with, who they are fine coming into their home or who they're not comfortable with coming into their home to help provide care. And then we put it all down on paper and we share it with those individuals. So the goal of this program is to educate, build that social support network, increase and improve communication surrounding dementia, because many times we don't have these conversations. Generally, a husband and wife aren't going to say, hey, honey, at dinner, let's sit down and talk about your future toileting needs. Just not going to organically happen like that. So this program really helps facilitate those difficult conversations. And then we learn to engage in healthy and fun activities for as long as possible. So this is a wonderful, wonderful program, a one-of-a-kind program. I have done this program with, at the start with a couple who said, well, we don't have any family in town. And we don't really have many friends. We don't really know who we can put in our social support network. That was week 1. By week 6, when we held their family and friends session, there were 13 people sitting around their table and even from afar that were on their team ready to help should they need it. So they were just surrounded by all this love and support. And we worked together on that to find who are these people, who's in your corner. And we dug and dug and dug. And when we reached out to them, all of them joyfully volunteered, yes, of course, if you ever need anything, I am here. And then people start specifically volunteering of if something happens to the caregiver, caregivers get sick, caregivers get injured. I'll help do the groceries. I'll help, come and cook a few days worth of meals and put them in your freezer. Or I'll help drive you to a doctor's appointment if you can't drive that week or the car breaks down, right? Life still happens when we have dementia, if we like it or not, and we can't control a lot of the outside factors. So you really need to build that social support network, and Share for Dementia is the most wonderful program to help get that done. It also really helps with that communication, like I said. Most people living with dementia are not quite comfortable talking about it. When you have a mediator like myself come in and help kind of start these conversations in a safe and appropriate way, we can have really positive communication about, you know what, honey, you're my husband and I love you, but I want you to stay my husband. And for that reason, I don't want you to have to get me dressed in the morning if I need help with that. Or, I don't want my son or my daughter to have to toilet me and change an adult brief if I need help with that. That I don't want to put that on them. Even though the children may say, "No, mom, it's fine. I'll do it. I'll do it." This gives the person living with dementia the empowering motivation to speak up and say, "No, that's not okay with me. I'm not comfortable with that." And we get the family all on the same page and supporting that person's core values and their care values of what's most important to them. Next, we have Star C. This is a fabulous program that I am just really deeply enjoying delivering to individuals in our community. So this was created at the University of Washington. It was created by a team of 3 different professors within the School of Nursing. And it's designed for the treatment of mood and behavior challenges in persons with dementia. So let's talk about that. So this program is a big time commitment. Big time commitment. How it works is this is a 6-month protocol. We meet once a week for 6 weeks, and then we meet once a month for 4 months, adding up to 6 months. We follow a scripted guide on various topics, and these include understanding problem behaviors and activators of those behaviors, right? What's causing it, what's triggering it, and then understanding the consequence of it or your response as a caregiver. We also have assigned reading for the caregiver who's going through this program out of the Understanding Alzheimer's guidebook. But don't panic, it's only 33 pages long, so you may only be assigned, 10 pages to read. So we're not talking chapters, we're talking pages on the assigned homework reading. So here's a look at the protocol. So we have a total of 10 sessions. The first 6 weeks are listed here. So we have in-home visits for weeks 1 and 2, then a telephone check-in for week 3. Week 4 is another in-home, 5 is a telephone check-in, and we end week 6 with our last in-home visit. Each in-home visit is about an hour. Now, if the caregiver has a lot of in-depth questions and wants to dive deeper into topics, that can push to an hour and a half to 2 hours, but we try to keep it as close to an hour as possible. The telephone check-ins generally are about 15 to 30 minutes long. Once those initial 6 weeks are completed, we move into our once a month follow-up phone calls, and those are about 15 to 30 minutes long. Now, These again are preferably done in the home. Why do we do that? We do that because it's just one less thing for that caregiver to have to do, right? To have to drive somewhere and meet us somewhere at the office. So we come to you and it saves you that time and energy. If doing in-home visits is not going to be effective or is not appropriate for that specific caregiver, that is okay. We can do visits here at our office, absolutely no problem. And they're always private visits. So, who is eligible for Star C? The person being cared for must have one of the following perceived diagnosis. You see that's underlined. You don't need to have it fully in their medical chart. So that's if you're perceiving that there's a Alzheimer's diagnosis or Lewy body or just any type of dementia, that must be present. The person with the perceived diagnosis needs to have some behaviors that are causing caregiver stress. This can't be things like toileting, right? Because we can't fix that. They're always going to need help with toileting. And even though that is very stressful and very difficult to deal with, we can't fix that or address that. So it has to be things like the examples listed below. Sadness or depression, crying out, anxiety or worrying, that very common phrase of I want to go home. Sleep issues. Many times people living with Alzheimer's disease are awake at night and asleep during the day. Resistance to care. If they're not wanting to bathe or change or even eat, things like that. Wandering is a big safety issue. So there has to be a challenging behavior that is causing caregiver stress and or causing stress for the person living with dementia as well. So this program is only for the family caregiver, but a lot of how you qualify for is based off of the person you are caregiving for. Also, to qualify for Star C, you need to be living with the person who has dementia. You need to be an in-home caregiver. You must spend at least 4 hours a day with them. So you can have hired help coming in, but at least 4 hours of the day needs to be kind of on your shoulders. And you do need to plan to keep their housing situation stable for the next 6 months. So if you are considering a move into a memory care environment, Star C would not be appropriate for you at that time. Who is this not available for? Star C is not going to be effective for any highly toxic or abusive relationships. If you've got a mother and a daughter who are fighting, who have a history of fighting, who have a long history of that generational trauma and abuse between the two of them, and now the adult daughter is stuck taking care of a mother who she is feeling angry towards, this is not going to be appropriate in that situation. This is not formal counseling. It's not meant to take the place of any sort of formal counseling that a caregiver might need. You must be able to quantify the challenging behaviors that you are experiencing. So that means you must be able to tell me, you know, Dad is doing this about 3 to 4 times a week, and it's really hard on us. So we have to be able to track and then document the improvement through the course of this, because remember, this is evidence-based. So we are doing research here and we're tracking and showing improvement throughout the course of this program. And you must be able to find respite or an activity for the person living with dementia during the sessions, as we do not include them in the sessions. They should not really even be within an earshot of where we are meeting. So we want to be meeting completely private. So that way the caregiver feels 100% comfortable to discuss difficult topics or frustrations that they're having with the person they're caring for. It's okay to be frustrated about your situation. It's okay to be frustrated with the person that you are providing care for. It would be lovely if all of us were angels 100% of the time. But we are human and we only have so much energy. And when we're low on sleep and struggling in the home, and we might be socially isolated, and we don't understand the disease that we are dealing with here, it's understandable and it's okay to reach those points of frustration. Star C is the type of program to come in and to help you with those frustrating moments so that we see them occurring less and we see your reactions not being as severe. So it's putting an end to that toxic cycle in the caregiving realm. Next, we have our early memory loss support and empowerment group. This is new, and we are so excited to be able to bring this. For the past 10 to 11 months, I have been talking with hundreds of families in our area. And the common theme that I'm hearing is there's a lot of support groups out there for my caregiver. There is nothing for me, and I'm the one going through this. I'm the one getting frustrated with my brain change. I'm the one feeling left out of these conversations. Where's the workshop for me? Where's my social network of people who understand what I'm going through? So we fixed that, and we have developed the first early memory loss and support empowerment group of its kind within our 4 counties. And we are very excited to be able to bring this to you. So we are beginning our first one on December 12th in Jefferson County. We're going to keep that first one small to about 8 people. Depending on the need and how that goes, when we open the one in Clallam County in early 2025, most likely January or February, we're kind of waiting to see what the winter situation is like, right? If there's a lot of snow and icy roads, people do not feel safe going out to travel if they don't have to. So we may want to start more mid to end of February, but we're just kind of waiting to see what that looks like. So, but we may increase the amount of people for that group. And this will work meeting once a week for 6 weeks. And the goal is to provide connection with others in your community who are living with brain change like you and experiencing early memory loss. This can be a very uncomfortable and scary time, especially if you're going through it alone. And we don't want people to have to do that. We want you to be able to share space with somebody where you can talk about, gosh, I get so frustrated when I can't remember the names of people and I'm constantly writing notes and then I'm losing my notes. And you can have somebody who, instead of saying, well, just try this, you can have somebody say, I know, I get really frustrated about that too. And it's such a different response, and you feel understood for once. So we want to focus on building new friendships and camaraderie in the group. We want this to be a safe place to express those feelings about the brain change that people are going through. And it's okay if those feelings are not nice. It's okay to say, I hate this. Why me? I'm terrified. I don't want to go through this. When you go home and you have to feel strong in front of your family. So here, it'll be okay to fall apart, and you'll be helped and held up while you feel safe to fall apart for a little bit that week. And each week we meet, we're also going to focus on a tip as well as a very empowering topic for the group. So things like our legal issues. hey guys, we're going to be going through changes. It's very important to make sure we have our legal paperwork and our affairs in order, because there will come a time where you're not able to make those legal changes anymore. So what does that look like? We'll go over our dementia roadmap, which is a wonderful, wonderful tool developed by the Dementia Action Collaborative. When we send out resources for these things, I'll make sure to have a link to that in there as well. So we will have some tips and some empowering topics, things that people can do, and just some feel-good motivation as we understand that, yes, this is a scary time. This is a scary thing to go through, but you can still live a long, healthy, and fulfilling life as you go through this brain change. We want people to really feel that. So who is eligible for this? It's going to be individuals experiencing early stage memory loss, or you don't need to have a diagnosis at all. Or it could just be the mild cognitive impairment, MCI. So if you're just feeling a little foggy, or it's maybe you've said maybe just a little foggy, but it might be a little bit worse than that now, this would be a safe place for you to come. You must be able to care for yourself. So this is how we're going to gauge who's appropriate or not for the group, because we want to keep this group somewhat high level and conversation able to be had. So we're going to gauge that by, are you able to still care for yourself? Are you still able to manage your medication? Are you driving? Are you able to cook? Are you able to be left alone at home? If you're at a stage where, no, I'm not driving anymore. No, I'm not able to go to the grocery store by myself. No, my spouse has to stay with me 24 hours a day. Or I'm not able to call my doctor because I don't know who my doctor is, or I don't know how to manage my medications. You may be a little closer to the middle stages of that memory loss and not appropriate for this group. We want you to be able to follow conversation and to feel comfortable talking and listening to others talk about their memory loss and other dementia-related symptoms. Because memory loss is only one symptom of dementia. There are many, many symptoms, memory loss only being one of them. But it is the most talked about one and the most feared one as well. So just to revisit, these are our programs that we are offering. We have been busy working hard since January 8th, 2024 to put together these. These have been hours of trainings, certifications, and bringing these to life, marketing them, educating the community. And we are really happy that this ball is rolling. We are full steam down the tracks and really able to be providing a lot of these wonderful resources to all levels of people involved in this. So we have programs for the public. We have programs for family caregivers. We have programs for in-home family caregivers, main caregivers. And we have programs for the people living with dementia themselves. So we've really tried to hit all of those levels of people who are involved in the care of dementia. And we're really happy to be where we're at here today, not even a year into this program starting. So ways for you to get involved. The first one, it's an easy one, is to become a dementia friend. All you have to do is attend a free 1-hour information session. We do have one coming up on December. Let me check my calendar really fast here. We have one on Thursday, December 5th at 5 p.m. at the Port Angeles Senior Center. And these are free. You don't have to sign up ahead of time to attend. So you can just drive on over and walk in and grab a seat. So I really welcome you to attend that free 1-hour information session. Also, you can become a dementia champion. So you can go through a training with myself and you can provide these free 1-hour information sessions. So if you're involved heavily with your church or at the senior center or at the library, anywhere at all, you volunteer somewhere, you may want to add this to your resume and become a dementia champion, and then you can provide these for the public and the people in your circle as well. Spread the word. Talk about this stuff. Talk about dementia with a smile on your face. Talk about it in a positive way and share some of the information that you learned today with family and friends. If you know somebody with dementia, go see them, go spend time with them, go let them know that you see them and that you support them and that you love them. If you have a friend who's a caregiver caring for somebody with dementia, send them a note in the mail telling them that they're doing a great job. Offer to sit with their loved one for an hour so they can go take a nap or go on a walk or read a book. Just connect with people who are living with dementia or caring for somebody with dementia. It can sometimes be a very lonely walk that they walk. You can sign up for one of these evidence-based programs if you yourself are in need. So if you are a loved one, get in touch with me. I have my information listed down below again. And then just call me. If you don't know what it is that you need, call me. Since July, I have done over 46 individual telephone consultations. So I am happy to receive your call and we can just talk things through. We can just talk about caregiving, some challenging behaviors, resources in the community. Maybe you need to set up a POA. We can just talk it out. If you call me, it doesn't mean that you need to then be moved into one of our evidence-based programs. I am here as a resource for you in the community. So I gladly accept your contact anyway, or if you're more comfortable with email, you can email me as well. Okay, so I have reached the end of this presentation. I want to thank you so much for your time and attention. My information is on the screen. I am based in our SQUIM office, and I do cover all 4 counties. So I am on the road and busy and out of the office a lot. But if you call and I don't answer, leave a message because it goes straight to my email. So wherever I'm at, it'll ding me right away that I've got a voicemail, and I check those immediately every day. So I will be in touch with you shortly if you can't get a hold of me. But now we have some time for Q&A.
Thank you, Bree. And a participant did post a question. It came to me in the chat. I will read it out to you. Thank you, Bree, for such a comprehensive summary of dementia resources for our community. Is there a counterpart if the person with dementia is in a long-term care facility?
Yeah, so for a lot of our programs, it is designed for the in-home family caregiver like Star C, but share for dementia, if they're in the early stages, share could be appropriate. You do not have to live with them in order to access our share program. Also, our dealing with dementia workshops. That is for family caregivers, but you don't have to be living with the individual. So if your loved one is in a memory care environment, you could still attend that as well.
Any other questions or thoughts?
I want to say that I've found it very educational as someone who has been losing words for years, and wondering about, am I going down the same road my mom and my aunt went down? Um, you know, it's it's good to have information, and more information makes it less scary.
Yes,
And
thank you.
when I've had my Medicare yearly um, wellness visits and stuff like that, and you do the memory test thing, passed flying colors, but I don't pass it flying colors in my book all the time. I had to ask Google about, I couldn't think of the word. I had to ask Google what the word was. I was looking for the word rivet and I couldn't find it. And I was lucky enough to actually find enough words to ask Google so it could tell me what I was looking for. It's not always possible.
Yeah, it can be really frustrating. But the fact that you can remember now
Yes.
you needed to ask Google to find the word rivet is a really good sign.
And I can still remember the word rivet.
Yes, yeah, yeah. We all lose some cognitive function as we age. So
Yes.
normal aging does include some slowing down. It does include some difficulty finding words every now and then. But the fact that you knew I have a resource and I can go on to Google and find the word I'm looking for is a really good sign.
Yeah, I think so too. It's use all the tools you can get.
Yes.
And I did just turn 70. Well, depending on what hour you want to count. Today is my 73rd birthday.
Oh, happy birthday, Evelyn.
Yeah,
Thank you for spending your birthday with me. I'm honored.
I'm honored too. I'm honored that you enjoy the work you're doing. I could tell from your presentation you absolutely enjoy helping people.
I do.
Thank you for that.
Thank you. Yes, I do. I do.
I echo that sentiment, Evelyn. I was having the same thought, Bree. It's clear that this is a passion for you, and that's infectious. And happy birthday, Evelyn. I don't know if you saw the birthday message in the chat. I put it in there before you logged on, so I don't know if it showed, but I wanted you to
No.
know that we were thinking of you.
Well, I really appreciate that. Yeah, Harbor Audiology and First Federal also sent me birthday greetings.
Well, very nice.
An
There you
email,
go.
like, yay.
Any other questions for Bree? All right. Well, I will continue with our wrap up here. Thank you, of course, Bree, for the incredible information. I learned heaps, and I've already heard you talk about this, but I still learned so much today. So thank you so much. On your screen now is a list of resources that can provide more information related to dementia care support. Those of you who are registered for Aging Well will receive that email I mentioned next week, which will contain all of these resources with links that you can click on and go directly to them. I will also incorporate links to that Bree shared in her presentation as well. So those will all be collected in one place for you, along with the link to today's recording. Our next Aging Well program will take place again here on Zoom at 11 a.m. This one is going to be in March, Tuesday, March 18th at 11 a.m. The planning is still in progress, so all I can say is check back. Keep checking our event list on our website, and we'll get that topic up there when it comes together. And but hopefully we'll be able to catch up with everybody in March. And thank you again to Bree Buchanan. Thanks to all of you for your interest in aging well, and thanks to the library's friends organizations across the county for supporting this program. Take care, everyone, and we will see you next year.
Thank you very much.